Welcome back to the Extra Point right here on KDUS AM1060. He's Bob Kemp. I'm Kayla Mortellaro with you up until noon today, as we typically do Mondays, Wednesdays, Thursdays, and Fridays. But right now we're taking a little bit of a detour here from the X's and O's, or even really the trying to get the logistics started for sports, to talk with Dr. Calvin Kwan with SCNM. He has got specialties in sports medicine, as he's previously worked with the Seattle Mariners as well as the Seattle Saracens Rugby Club. Do I have that right?
It's the Seattle Saracens Rugby Club.
There we go, the Seattle Saracens Rugby Club. I'm not too familiar with rugby, so maybe we could get some rugby questions in. But thank you so much for taking some time with us today.
Absolutely. Thanks for having me, Bob and Kayla.
So when we look at the NBA as well as the MLB now have paths to trying to restart or start their seasons. The NBA, though, they were right in the middle of the season, had to stop. MLB had spring training underway, then they had to stop. So what does it take for a player to get themselves in performance shape, exercises, stretching, the type of workouts needed that are going to prevent those injuries, but also maintain peak performance? Because being in athletic shape is just different than being in shape.
You'd actually be surprised about the professional athlete. They actually recover pretty quickly. But now the problem is if they've kind of diverged from their diet or program during the breaks, during the break.
Yeah.
So,
I'm sorry. Go ahead.
Oh, no. Go ahead.
No, I was just going to kind of touch on the NBA a little further. The at least the first part of the NBA restart is scheduled to be this, the 8-game, basically for, to finish the quote regular season and seeding process, et cetera. And they're going to play, it appears, like those 8 games over a 16-day span or so. What dangers does that incur as trying to stay healthy?
Yeah, so, obviously, first and foremost is going to be the whole pandemic itself. And so as long as players know, that they got to just, keep social distancing to the best of their ability. A lot of players, this is just silly, but a lot of them lick their hands, and just kind of put some grip onto their shoes, contact the ball to get better grip. And so those are the kind of just, habits that they're going to have to kind of refrain from and, constantly use hand sanitizer. So pandemic-wise, there's going to be some habits that they're going to have to curb for obvious reasons. Sharing of bottles and things like that, equipment, going to be very different. Absolutely.
When you talk about, pandemic aside, and you look at just the muscles and getting them to respond, and really as you talk about, how much preparation of exercise do they need to get back into playing shape, as I'm sure they probably haven't been training as rigorously as they would if they were in season. So to get back to that level, and then as Bob there mentioned, how many games in a row or in successive days, does that have a factor?
This absolutely has a factor, and we're having a lot of patients come in nowadays with, with absolute changes to their play. We have, high school players coming in, and they're not practicing as they used to be. And so one of the risk factors is going to be returning to play too quickly. So returning to play in an intensity that they were used to pre-pandemic. And so what they're going to have to do is going to have to slowly introduce or have graduated increases in their activity. So for the first couple of weeks, it's going to be pretty short intervals, and it's going to be less intensity, and then slowly work it up. Their bodies are going to remember what they're capable of, but it's just going to take some time. The muscles get tighter, the ligaments, tendons get tighter, collagen starts setting in, especially if you're not as mobile. Maybe you're seated most of the time, and not more sedentary. That can play a factor for sure. And if there's any ongoing conditions like inflammation and or pain, those things can start to take hold pretty quickly if they aren't treated.
Yeah, as far as before they start the schedule, they're going to have basically a month, and I know some teams have had some individual workouts and so forth with players over the last couple of weeks. Do you think that the time between when they started to so-called get back into shape and the time that they actually start on July 30th, is that a sufficient period?
That really freaks me out a little bit. But I think with their scope and their capacity to have a team that supports them, just like the doctors that we have at the Southwest College of Naturopathic Medicine. We are able to put our hands onto our patients and kind of break down any of that, those adhesions or, kind of help move inflammation. So having that work in addition with their athletic trainers, the massage therapists, their chiropractors, their naturopaths, having that work in addition, maybe just a little bit more that they're used to, might help kind of increase that capacity for them to heal, as well as getting them back into play or get into their playing capacity that they were pre-pandemic.
Dr. Calvin Kwan joining us here on Extra Point right here on KDUS AM1060. So when you're focusing here on NBA players and you're also talking about Major League Baseball players, what they want to get out of their bodies are very different. So therefore the workouts are probably different. So can you kind of walk us through maybe what things basketball players are trying to get their bodies to do with explosiveness versus maybe what elasticity baseball players are trying to achieve?
Well, I mean, being that, we have so little time, but, with each sport having their own specific nuances, general recommendations are to start off with, kind of, like I said, more body weight type exercises. And so using kind of cables and or, resistance training too soon could increase their risk for injuries. And so dependent on the sport, you're going to have to cater to more body weight exercises until the body is capable of moving and increasing their range.
Yeah, as far as baseball is concerned, Mitch Haniger, who used to play here and now plays in Seattle, and unfortunately, the poor dude's been hurt a lot, soft tissue and non-soft tissue, unfortunately, too. But he mentioned, the last couple of days about he's concerned about oblique injuries. You think there's that's a valid comment from him, or good, an accurate comment?
I've actually interacted with Mitch a couple of times up in Seattle. He's a great guy.
Yep.
Other than that, no, it's these injuries. Like I said, if you're not moving, if you're not taking care of it, they start setting in and having a little bit more scar tissue. And if let's say Mitch, for example, decides to just go and play, he's going to have a higher risk of tearing down that scar tissue, because it doesn't have that elasticity, it doesn't have that mobility that it has to kind of dynamically interact with him as he tries to perform his activity.
Let's stick with the baseball just for a second, but how much different would be a program you would maybe suggest for a pitcher trying to come back? Usually it's 6 weeks of spring training. Obviously, that's going to be far less this time as opposed to a position player.
So a lot of, at least starting off, is going to be about mobilization. So a lot of stretching type exercises and range of motion. Absolutely.
Dr. Calvin Kwan with SCNM in his sports medicine background, working with the Seattle Mariners as well as the Seattle Saracens Rugby Club, joining us here on the Extra Point. We talk a lot about soft tissue injuries, can you maybe break down from a medical perspective what we're actually saying when we say soft tissue injuries?
Soft tissue is a wide range. We're generally talking about anything from the skin all the way down to the ligaments, tendons, and even the bone, if you think about it, because they make their attachments to the bone. So any of those things that make our body move to help move our joints, move our bones, keep us stable, keep us, those kind of things are the soft tissue that we're talking about. It can also include our fat, oddly enough, as fat is, or adipose is, part of our fascia. And so a lot of these things, if not moving, tend to get rigid, and we got to break these things down either through our foam rolling, through our massage therapist, through our joint manipulation that we do. There's a lot of things that we can do.
As far as obviously we hear about hydration frequently, but I remember I watch college football games on a regular basis, but at the start of the season, and football, NFL too, there seems to be a lot more cramping early in seasons. So how's that change, things heading into these seasons on a quick turnaround, so to speak?
So, especially for Arizona, we always talk about hydration, but hydration can also be dangerous. When I'm talking about dangerous, I'm talking about over hydration with just pure water. Now, if you drink just water purely, you're going to be letting out the rest of your electrolytes just through going through urination. And so you do have to kind of pack in some electrolytes to kind of keep the water in. Otherwise, you're just kind of puffing up your body a little bit. So definitely get your electrolytes, get it into your system. That way the water stays in and actually, becomes helpful rather than detrimental to the body.
When we also talk about what you can do, so this is all training leading up to things, trying to get yourself in the best possible shape to restart the season or start the season in whatever case it is with MLB or NBA here. But when you're actually now in game mode and you may need to go into more of a maintenance routine of your workouts, what sort of things should they be looking for? And then are there also different types of therapies that people can have to maintain and help those muscles that may be a little bit more sore because of the gameplay?
Ooh, a lot of stuff there, but I'll try my best here. And so with the types of exercises, I think one general recommendation is just to avoid overactivity. Now, you don't want to overdo these things. I know that some people, maybe you have a pitcher and they're just going to try to get back to their pitching capacity of maybe 100 pitches, let's just say. And now you don't want to get back to 100 pitches 1 week after. No, you have to take it slowly. So definitely kind of start at kind of maybe a 25 to 50% of capacity, and then just slowly work it up to that capacity there. And so my general recommendation about exercise in general is just don't overdo it. Don't try to catch up to what you were pre-pandemic, and definitely just kind of, just work slowly. It's better to be, safe than sorry. Sorry. Mm-hmm.
No, you go ahead. Sorry.
As for therapies and treatments, and you guys do touch on soft tissue, and that is the kind of the crux of majority of what we treat at our clinic, and it's the soft tissue damage. And so some of the stuff that we can do are joint mobilization. A lot of our physicians at the Neil Riordan Center for Regenerative Medicine, we do platelet-rich plasma therapy. We also do stem cell therapy or injections into joints to help regrow cartilage, kind of stimulate that growth for those who have kind of a wear and tear issue. And we also just do a lot of soft tissue cupping, and we have acupuncture, and we do a whole bunch of things that are more holistic, and it kind of treats the patient as a whole.
When you say the soft tissue cupping, is that kind of what we used to see with Michael Phelps when he would come out with all those suction cup looking things all over his body?
That is absolutely correct. Yes.
Oh, okay. Very good.
Okay, kind of switching to sports here too. Football. Yes. The NFL announced yesterday training camps. Hopefully, at least the plan is they open at the end of July. Now, football players, they haven't had the off season that they usually have. How's that changed what they should have been doing or what they can do before, let's say, if things open and it's scheduled on July 28th?
So that's just, again, my recommendations to them is just kind of focus on their functional type training and kind of making sure that they can move correctly. Again, don't overtrain. Don't try to catch up. Try to stick to your diet. Don't have too much fun out there, and stick with your trainers. Your trainers know what to do. And I have a buddy out in the Arizona area who did the combine or helped with the combine, and he would say, just work on just mobilizing, just breaking things down and rebuild your movements from the bottom up. And just this is a great chance to kind of improve your game, essentially, literally improve your game.
Dr. Calvin Kwan with SCNM and sports medicine background here. Appreciate all of the time that you have provided to us today. So I do want to ask, though, before I let you go, what was it like working with the Seattle Saracens Rugby Club? And can you give us any pointers about rugby?
It is a tough sport to watch, but they are amazing. Rugby is a phenomenal social sport, and it's a great community, and I love them. I miss them. And other than that, you have to have a stomach for this man-on-man contact, even women on women. We have women's team and men's team up in Seattle.
Wow. All right. Well, I'll see what I can do and see if they have some YouTube clips or whatever to find out some more about the Seattle Saracens there. But Dr. Calvin Kwan, thank you so much for your time today.
Absolutely. Thanks for having me on.
Once again, Dr. Calvin Kwan with SCNM Sports Medicine here has had training and worked previously with the Seattle Mariners as well as the Seattle Saracens Rugby Club.